With the Pfizer vaccine now making its way across the country, we wanted to find out more about the details surrounding its distribution. So we're joined now by Dr. Kevin Ban, the Chief Medical Officer for Walgreens. We thank you for joining us this afternoon.
Well, thank you, Carolyn.
So explain how phase one is going and how involved are you in this first phase of the distribution plan?
So we have been working very closely with the CDC, HHS, and Operation Warp Speed really since the beginning of this. Everyone knows that on Sunday, Pfizer began to ship vaccine out to the states, and that already yesterday, you're seeing healthcare workers, the folks who are really on the front lines of this pandemic, being vaccinated. Walgreens is supporting that effort in distributing and then administering that vaccine. Next week, the next phase of this will be to include long-term care facilities. We will be going out to long-term care facilities to vaccinate not only the people who live there, but the employees who work there. So we're integrally involved in this, working very closely with OWS and making sure things go smoothly.
And so how long do you think this first phase, or at least the first shot in the first phase, how long will that take, do you think?
Right, so this starts with phase 1A, which that's the healthcare workers, long-term care facilities. Also in phase one, we expect essential workers and people with chronic medical problems. Our expectation is that this will take us through the end of February into March to complete. And then as soon as the end of March, let's call it early April, early spring, we're going to have vaccine available for the general population. And then Walgreens will be leaning into its infrastructure to make sure that we do that smoothly.
You talk about these future vaccines that we're hoping will be equally approved, just like this Pfizer one is. You're talking about April for the general public getting this option. With these new vaccines coming on board, might that speed up the process?
Without question. You know, we have Pfizer that received emergency use authorization last week. We expect that Moderna will get their emergency use authorization the end of this week. And then in early 2021, we expect that Johnson & Johnson and likely AstraZeneca will get their emergency use authorization. The more product we have, the more supply that we have, the more that we can distribute and then administer across the country. So those elements are critically important.
Very, very interesting time in all of our lives happening right now. We sure appreciate you kind of helping us figure out what is happening behind the scenes. Thank you for joining us.
Thank you.